Well, there's an estimate that by 20 years from now, there's going to be almost 98,000 drivers with dementia on Ontario roads alone. So nationally, we're talking in the hundreds of thousands of drivers with dementia as time progresses. And driving with dementia can be quite unsafe. In the later stages, patients' memory, their reaction times, their visuospatial skills and problem-solving skills are all very poor and pose a great risk to driving. In most of Canada, and certainly in Ontario, there's a legislation that says that one physician must report patients that have medical conditions that impair their driving ability. The guidelines across, even international guidelines, recommend that in cases of mild dementia, patients be referred for specialized on-road driving tests. And that's what we try to do as physicians. So we're mandated to report, but we also, when patients are uncertain, we are meant to suggest an on-road driving test. But that's not, that process is not so easy at present. Right now, as a physician, we can certainly ask the patient a lot of questions. We can test their memory, their reaction time in the office, but what we can't do is see them drive. None of those, there have been a lot of studies done looking at tests that you can do in the office, but no one test has been shown to accurately predict real-world collisions. So you can ask the patient's opinion, and that's just about as good as chance. A lot of patients, because driving is so important to them, will say they're perfectly fine drivers, even in the late stages when they're causing lots of accidents. Family members do somewhat better. But in a recent study, neurologists, a very experienced neurologist, tried to rate whether someone would pass or fail a road test on the basis of all available information. And they were able to successfully categorize 3 out of 4. But that means that 1 out of every 4 patients, they were unable to predict whether they would safely or unsafely drive. So we are recommending, and certainly internationally, the recommendations are that we should have an available road test. In Ontario, it's very expensive. It costs about $500, and it's not subsidized at present. The physician has a divided duty. The physician has to care for the patient, but also protect society, and driving is a privilege. It's not a right. And so we recommend these tests, but I believe that it's unfair that we're asking the patients and families to pay for the tests. And we're asking, I don't believe it's fair for the physicians to have to do that assessment when our tools in the office are very limited. Our first recommended solution was to enhance and make available and affordable the on-road tests, to make them subsidized by the government or by private insurance or by private car companies, so that safe drivers can remain on the road and unsafe drivers can be taken off the road. I'd like to use the analogy that physicians should be able to order a road test the same as they order a lab test or an MRI. It should be made that easy. Second of all, when people have to give up the wheel, we want to maintain their independence and their dignity. And in order to do that, we need elder-friendly driving alternatives. So, for example, in Ontario, in Toronto, we often will ask people to take a public mode of transportation that will privately pick them up, but it doesn't pick them up at their door. They have to go to the curb. The time of pickup is unpredictable, unreliable, and the duration is very long. Other recommendations include educating physicians about the importance of asking their patients, does your patient drive? Does your family member drive? And what are the concerns? To raise it in the discussion. That's often not being done. And to remind them of the legislation and the guidelines that we need to assess their driving on the road. I also think that funding is needed urgently in order to develop better office-based tools. So in the future, perhaps we could find an evidence base where we can do something in the office to predict driving ability. We don't have that right now. And we need to study other factors, cognitive and non-cognitive, that can predict driving safely and unsafe driving. Eventually, all patients with dementia will become unsafe to drive. We need to take the patients with mild dementia and assess them, and then reassess them over time, every 6 months or at least every year, to see whether they're driving, at which point their driving becomes unsafe. So this becomes a very practically difficult situation. If we are going to maintain the independence, we want to maintain it, but make sure we're not harming people or harming the public along the way. I think it's really important that clinicians work together with government, with insurance, and with physician educating bodies and the medical schools to advocate for an evidence-based, practical, and affordable way of assessing the safety or lack of safety of older drivers who have dementia.